Hi, Robert. I'm Mandy Bell. I'm going to be working with you today.
Hi, nice to meet you.
I'm glad you can make it. Would you like to have a seat?
Yeah, sure.
Great. So, did you have any trouble finding it?
No, it was pretty easy.
No? Okay, good. So, before we get started, I just want to go over a few things. So, the way this works, like anything you say within the meeting is confidential. So that means I'm going to keep it, just between you and I won't disclose it to anyone else. The exceptions to that are if I feel like you are a harm to yourself or to anyone else, or if you report any sort of child abuse or elder abuse, then I'm a mandated reporter and would have to report that.
Okay.
Or, in the rare case that I was subpoenaed by a court, but that really never happens almost ever. So just wanted to let you know, those are the situations, but everything, that you say is just between the two of us. And, on that topic, have you, had any thoughts of hurting yourself, or, do you have any feelings of being suicidal?
No, not really in the past or today.
Okay, not in the past or today?
Mm-hmm.
Awesome, that's wonderful. So can you tell me a little bit about why you're here?
Okay, so I just got back from a 10-day stay at a diagnostic center.
Okay.
Yeah, so I was treated there for, I'm having all kinds of issues in my stomach. I'm pretty sure it's colon cancer, but it seems like when I get the results, it's kind of loud. When I get the results, there's no results that come back positive for anything. So I've seen radiologists, and a gastrointestinal person is who sent me to the diagnostic center, and that's when I got an endoscopy, a colonoscopy, a bunch of stuff, and it was all negative, which is really horrible to hear for me because I really feel like they're missing something.
I can understand. So do you feel sort of anxious about that?
Yeah, because I feel like the longer I wait, the worse it's getting, and I can feel like masses in my stomach, and I feel like they're missing something for sure.
Really? How long have you felt that way?
Well, it kind of started, my brother died at a young age, and he died from a heart murmur.
Uh-huh. Sorry to hear that.
Yeah. But
How old was he?
He was only about 10.
Okay.
So it was traumatic for our family. But so then I got checked for a heart murmur at school, and they said I couldn't participate in gym anymore, and then they said the heart murmur was benign, but I still felt like I could feel my heart like doing something else than like that I wasn't supposed to. So I guess way back when I was in middle school is when these issues started, but then they said nothing was going on, and I kind of just forgot about it, and then I went to medical school, and we learned about a lot of like diseases and stuff, and I feel like everybody was like a little concerned that they had them, but I feel like maybe my concern was more than theirs. And then recently, I guess the stomach pains started after I finished my residency for medical school. So
okay. And how long ago was that?
Probably about 10 years ago.
I'm just taking some notes.
Yeah.
If that's okay for my to be able to recall later. So you said, was your brother older than you or younger than you?
He was older than me.
He was older than you. And so what was that like? You said it was traumatic for your family. What was that like for you?
It was stressful because it made me, not only that he passed away, and my parents were really upset by that, and so was I. It was more like I felt like maybe now I could die at a young age because of genetics and, you know, a heart murmur, and since I had one too, so it just created a lot of stress for
Mhm.
everyone, the death and thinking that there could be something wrong with me too.
Mhm.
Mm-hmm.
And you said that they followed you, you know, kind of did a follow-up with you, and your heart murmur, has that resolved, or they've just decided it's benign, or?
They just told me that it was benign and that there was nothing that they needed to do to fix it. So it kind of just, I guess it's gone now, or it's still there, but it's not bothering me. But sometimes, you know, I think about it and it gives me a lot of anxiety, because maybe what if it does affect me again one day and they didn't do anything.
Mm-hmm.
So.
How often, like, you said lots of feelings of anxiety, like, describe that. What does that mean?
So it starts with, like, different behaviors that I'll do. So, like, if I'm at home, maybe, like, and I feel something going on with my stomach, I'll give myself, like, a physical exam, like, every day usually, and then I check my.
And is that something you learned in med school, like how to do? Okay.
Yep. And then I also check my stool for blood every day, just to see if anything's going on with that. I sometimes stay after. I'm a radiologist, so I stay after work sometimes and will give myself x-rays just to see if there's anything going on. So I usually check every day, and I feel like that's part of my anxiety.
Okay. Is it safe to give yourself an x-ray every day? Do you know?
I put the necessary equipment on to protect the other areas I'm not x-raying, but.
Okay. Has anyone at work noticed this behavior?
No, I usually do it in secret.
Okay. And so you have anxiety about the heart murmur and your stomach issues, and you, what about, let's see, and you said it started about 10 years ago, the stomach pains? Okay. And in that time, like in that 10 years, what treatment, I know you said you just went for diagnostic treatment, but have you done other things in the past 10 years?
Yeah, they referred me to a psychiatrist for this also, but I think, you know, that's not really what's going on. I think there's a medical issue, but I didn't feel comfortable with the psychiatrist before, so it wasn't really beneficial for me, and that just kind of fell off. And throughout, I've just been giving myself my own tests and kind of going in for checkups, and I went to dermatology too within the time period, and I got a skin place removed. They said it wasn't a problem, but I just needed it to be removed in case it was a problem. So a couple of different medical treatments.
Okay. And when was it that you saw the psychiatrist?
I saw one in the diagnostic place.
Recently?
Yeah, recently. And then I saw one about 5 years ago.
Okay. And you said you didn't feel like that was helpful. Why did you not feel that it was helpful?
Mainly because I felt like they were underplaying what I was saying almost. Like they didn't really believe me.
Okay.
That I had these issues going on. So I didn't feel comfortable sharing. Because, yeah, they didn't make me feel comfortable.
Yeah, I can understand that. And so, it seems like you've had some, like, health issues going on. Can you tell me about your family history? And so I know you have an older brother who passed away. Can you tell me did you have other siblings? No other siblings?
No other siblings.
What about your parents? Can you tell me about your parents?
Yeah. My parents are still alive. They're still together, and we had a pretty normal growing up life. It's always been my dream to be a medical professional, so doing that was something they also were happy for me to do. other than that.
How was med school? Was that difficult to get
Yes,
through?
yeah, because about 2 years in, I had some kind of medical issues going on with one was the skin, and the other was I started feeling the stomach pains, but I didn't really. I saw a psychiatrist also when I was in med school.
Okay.
But it didn't really turn out to be anything, and they kind of told me, you're never gonna finish if you have these issues. But I did it, and here I am. It was very hard, but then I feel like after, the stomach issues got worse, so it was kind of weird.
So I imagine that would be difficult to do medical school with, anyways, but then with other conditions on top of that, or
Right.
having illnesses. Did your stomach issues and the skin issue, did that prevent you from attending classes?
No. So
No.
I've always been really good with, my attendance was perfect, very driven, and then even with my work now, I'm always at work. I don't ever miss anything. I don't let it impair me, but I still think about it all the time. You know what I mean?
And with your parents, do either of them have any sort of medical conditions?
No.
They don't. So it was just your brother, and did they think that the heart murmur was hereditary, or just did they think it was maybe a birth defect, or do they know?
They said it was probably a birth defect, and that a lot of children seem to have heart murmurs, but they usually will grow out of them, or it doesn't affect them.
Okay.
So his just seemed to be more serious. The hole never closed in his heart, so that's why maybe it was hereditary, but they didn't really specify about that.
Did your relationship with your parents change at all after he passed away?
Yeah, it seemed like they were really sad for a long time, so I never really knew how to act around them, or if I was going to be enough with just me now and not my brother. But after maybe 2 years, our relationship kind of started moving back into normal.
Okay. And like in middle school, tell me, you said you had symptoms starting in middle school. And how old were you when your brother passed away?
I was
older.
So he was older than me. He was 10 when he passed away, and I was about 7.
Okay. And so you said in middle school you had some symptoms start. So that was a few years later. What kind of symptoms were you experiencing in middle school?
I felt like I could feel my heart skipping a beat.
Okay.
Even though they were telling me it's not affecting you, it's benign and whatever, but I still feel like I could feel my heart doing weird things. And then I think with my brother dying too, it kind of intensified those fears I had. And but after about like 2 years with the heart thing, I kind of just stopped worrying about it. It's still a thought in my head, but it's not at the forefront anymore.
Did your parents seem concerned in middle school? Did they?
No.
They
didn't seem concerned after the doctor said it was benign, but I kept being like what if he missed something? Because this isn't my heart. I could die if he did. So.
I imagine that would be scary.
Yeah. And you never know if they're doing all the correct tests or not, so I just feel like it should have been checked more, but obviously I'm still here now, so.
That's very good. What about high school?
High school was good. I was a hard worker. I got good grades because I was trying to get into med school, and I don't remember really having many symptoms throughout high school, or like the same issues going on.
Did you play any sports in high school, or no?
No,
Okay.
I was more just academics.
Okay.
And like school clubs.
What kind of clubs did you do?
I did student council, stuff like that. There was something called peer leadership, where I would assist my peers with stuff. Other than that, it was mostly academics.
Okay. And then where did you go for undergrad or college?
I went to Georgia State.
Okay.
And for my medical school, I went to Emory.
Okay. And what about in like undergrad? Did you have symptoms, or how was undergrad? How were your grades?
My grades were good. It felt like the symptoms kind of initially began when I started learning more about the body.
Okay.
So it was like I could almost diagnose myself because I was learning about it.
Mm-hmm.
So, and other kids too would be like, maybe we do have this because we feel this way, and
Mm-hmm.
I feel like we all kind of laughed about it, but I kind of took it seriously and was
Mm-hmm.
teaching myself how to test things on my own body and
Mm-hmm.
figure that out. So,
Do you ever, like, anytime I've seen videos with, like, or TV shows where there's lots of, like, bugs crawling on someone, I always start to itch.
Yeah, exactly.
It's sort of
stuff like that.
Like that.
Yeah.
And then I feel like there's things on me. So do you, and I mean, the brain and the body obviously are very interconnected and entwined. Do you think that any of this could be sort of psychosomatic? Do you think that there's any, I know you've seen a few psychologists and you said they didn't take you seriously.
Mhm.
From your own medical perspective, do you think that there is any possibility that they are intertwined or any relation?
Thinking about it more, I do see how maybe since it kind of began around when I was learning about the body, maybe I intertwined the two.
Mm-hmm.
But the stomach issues I feel are real. I feel
Mhm.
like maybe I'm developing like colon cancer
Mhm.
with what I'm feeling in my stomach and stuff.
And what does it feel like?
It's like rumbling sometimes, and sometimes there's like a mild pain, and then in my left abdomen there's like when I push on it there's like a mass. So I usually check, like I said, and so one time my son, I have a son,
Mm-hmm.
he came into my room and I was doing my abdomen observation, pushing and stuff,
Mhm.
and he was like, what's it this time, Dad, or something like that, and it kind of made me break down a little bit about it because it kind of adds to the fact that maybe it is psychosomatic,
Mm-hmm.
because if my 9-year-old son thinks that, oh, what could it be this time, since there's always something wrong with you, but everything's negative, so how would I react to that,
Right. And so does your son have any underlying medical problems?
Mm.
No? Okay.
He's perfectly healthy.
And are you married at this time?
Yes.
Okay.
I have a wife. She works as a teacher at a nursing school.
Okay.
So.
And what are your perception, like, how is your relationship with your wife? Do you feel like she is supportive? Does she seem to understand your concerns?
I feel like at first she was on my page and like concerned with what I was concerned with, but now she kind of feels like I'm wasting all the time we've like spent getting our degrees and like doing this together. It's like now I'm wasting our free time with worrying about what's going on in my body, because even when I'm not at work, I usually just stay home and like lay in bed, or like, because I don't feel good. I feel like something's wrong. So I feel like she's not as happy as she used to be, or supportive, because I never want to do anything outside of going to work.
Mm-hmm. And how does that make you feel, like not feeling like you want to go do things after work? And
It makes me upset. I want to do things with my wife and my kid. I want to take trips and, you know, use this time to enjoy my life with my wife. But I don't know. I can't get this stuff out of my head about I don't want to die randomly when we're on a trip or something and get some kind of crazy illness when I go there. It's just like I have to figure out the problem first, you know.
Okay. And so do you guys do anything socially? You said you stay in most of the time.
Mm-hmm.
So did you used to go out, or is this recent that you don't get out, or?
I went out a lot, like when I first graduated medical school with her. We were celebrating all the time and stuff like that. But I feel like probably a year after medical school is when all these issues really began, and that's kind of when I didn't want to do anything anymore.
Okay. Have you ever, so when you guys were going out and celebrating, did you use many substances? Like, did you guys go out and drink or party?
Mm-hmm. We usually just drank with friends socially, so we've never, we'll keep a bottle of wine at the house and stuff, but we don't really indulge like crazy. But during those times when we were celebrating graduating med school and stuff, I probably indulged a little bit.
Yeah, to celebrate. That's a big accomplishment. So, do you feel like you've ever had trouble with like a substance use? Or you haven't been able to stop taking a substance, or had lots of desires to take a substance?
Mm-mm.
No. Okay.
No. And my wife, she hasn't had any issues either.
Okay. And have you ever had any legal problems?
No.
No? Okay, good. So, was it two, just to clarify, I know you've said, I have written down two, but then you said you also saw a psychologist in college. So have you seen two or three? Three different psychologists?
Now. Yeah.
And?
But only one session. Like
one session for each of them.
Yeah.
Oh, so you haven't really ever had any like treatment or discussions about it. Okay.
And then the one in the diagnostic center for the 10 days was just like an interview, like how we're doing now. But it wasn't. I didn't like her that much. So it wasn't beneficial at all.
And so at this diagnostic center, you were there for 10 days. You saw the radiologist, a GI specialist, and did all of the tests come back as like completely normal? Were any of them?
So all of the gastrointestinal tests were negative, but there was one test that came back positive for something abnormal in my urinary tract. But they said it didn't affect anything, and that it would just go away on its own, and it wasn't serious or anything like that. But I just still feel like they're missing something going on in my stomach.
So you still are having the same symptoms? Okay. So, and what did this, you said you didn't like the psychologist that you saw at the diagnostic center, but what did he or she have to say? Did she or he provide any sort of diagnostic like input for you? Or?
They didn't really try to diagnose me yet with anything, but mainly she just kind of dismissed my claims about how I'm feeling. Like when I said I'm having stomach issues, she would be like, well, if the test came back negative, then what stomach issues are you having? Type questions. And it's just like, that's not helpful to me at all.
Yeah.
And even if it is psychiatric going on in my head, like that's still not a question to ask me.
That doesn't make you feel like she's listening or any of them are
validated.
listening.
Yeah. So that's really what she did. But you know, nothing against psychiatrists or anything.
Right.
Just her.
Yeah, I can understand, because it sounds like, I mean, if you're experiencing, you know, symptoms and someone's telling you you're not, I mean,
Yeah,
they-
that's not.
yeah, I mean, nobody really knows what you're experiencing, so.
Exactly.
So it sounds like, let me just double check my notes and see what else. And with work, do you feel like this is currently impacting your work?
Not at all.
Not at all?
Yeah, I have great work reviews, great attendance to work. I never miss a work day based on anything, how I feel, unless I'm like,
So
got the
even
flu
with your
or something.
symptoms and
Yeah.
even with not feeling well, you're
Mhm.
still able to work and
Yep.
making it to work.
But that's why I choose to stay home when I'm not at work, because it takes a lot out of me when I'm thinking about all these things I'm feeling all day, and then when I get home I don't want to go out and risk making anything worse after I've already been out at work.
Okay, so it sounds like it's impacting your family life to some
Mhm.
degree because you don't want to or feel like going out and doing things with your wife. And you said your son mentioned, again, like, is it impacting, do you feel like it has an impact on what you do with your son or your relationship with him?
Yeah, he's 9, so he wants to go outside and play and do sports and be a part of social gatherings and hang out with his friends, and I just feel like I'm not really a part of it as much as my wife is, because I'm trying to figure out what's going on with my stomach, and I don't want the problem to continue to worsen while maybe I'm doing something fun with him, but what if something bad happens when
Right.
I'm there? So I just kind of will give myself the examinations when I get home if I haven't done the x-ray at work, and just keep up with stuff like that. And I do feel like it impacts my son, especially after hearing him say like, oh, what's it this time, Dad?
Right. So it sounds like you're having lots of anxiety about, your medical conditions.
Mhm.
And has that been persistent basically since middle school, or off and on? You
Off
think?
and on. It got worse like after the 2 years, after I kind of just like left the heart murmur alone.
Mhm.
Then it came again in college when we talked about the body and stuff and disorders and diseases you can acquire.
Mhm.
And then after medical school is when it mainly hit the surface, and like I feel like when everything kind of started happening more intensely
Okay.
was when I was done with medical school.
Okay. And you said you kind of keep it secret at work, so you don't
Mhm.
feel like any of your work colleagues are aware of the situation or
No.
condition?
Yeah, I don't want them to be asking me too many questions when I'm out of work. I don't think it's their business, and then I don't know if I'm actually allowed to be x-raying myself after work, so I don't want them to know about that either.
Right, that makes sense. So I think, it makes sense, if you would be up for it to look at, talking about this more, maybe setting up some other sessions, because, I'm not saying that your, stomach issues and, the symptoms you're experiencing aren't real, but, perhaps there is a component of worrying about them, as you said, like when you started learning about them in medical schools, kind of when you started being more aware. And certainly with the anxiety that you're feeling towards, having a condition, maybe we could talk and meet and, kind of see if we can figure out some of that.
Yeah.
Especially with your medical expertise, it might be helpful for you to sort of look at it, from a different
Mhm.
perspective.
Maybe I could look more into the psychological
Mhm.
aspects of what could be, maybe it's stress is causing
Exactly.
my stomach,
Exactly.
So.
There could be some other components that might be adding to the symptoms, or making, exacerbating the symptoms.
Mhm.
And so, maybe we could talk and figure out, some other ideas as to things, that might be making things worse for you. Do you have any questions for me?
Not really, no.
No.
But I feel like this is one of the best therapy sessions I've had.
Oh, good.
So,
I'm glad to hear it.
Yeah,
So,
I would love to meet again.
okay. So I think, maybe we could look at scheduling something, and, let's sort of talk about it, and maybe I can find, or I'm sure, you have the resources to sort of look at, anxiety and different things that can contribute, to your physical symptoms, and, let's take an approach and sort of look at it that way, and, maybe we can follow up in, maybe another week or so.
Sounds good.
Okay.
Sounds great.
Well, it was nice to meet you, and I look forward to seeing you next week.
You too.